So let us wait for more participants to join. Maybe in 2 to 3 minutes, we shall be beginning. Okay.
Yeah, sure.
All right. Good evening, everyone, once again. So today's webinar is on digital health, AI, ML in healthcare. AI stands for artificial intelligence, ML stands for machine learning. So our chief speaker today is Dr. Hariprasad Mishra. Welcome, Dr. Hariprasad Mishra. Let me go on introducing him first. So he's a doctor of medicine from Delhi University in clinical pharmacology and therapeutics. He has completed law from National Law School of India and healthcare management from Indian School of Business. His interest follows an intersection of medicine, healthcare management, and law. He's presently working at Antara Senior Care as a medical doctor consultant. He was a researcher at PGI MER, where he was a part of cohort in ASTA A69 Arogya. He worked with government as a clinical lead in AI/ML project. Besides this, he has already undergone 12 months of residential training at GTV Hospital, New Delhi, and has attended as a doctor, OPD, OT, IPD, and ICU. He has worked with COVID patients and has come across as a change agent. He has also delivered medical coaching and content materials in zoology, taught to thousands of students in BYJU'S for 2 years from 2015 to 2017. Okay, so he has also published some of the journals related to genomic surveillance of COVID, eradication of viral diseases, Delhi's corona fight on it, Doctor's Eye, mucormycosis in COVID times. So welcome, doctor. Today he's here. He will share his experience on how digital health and AI/ML has saved in his professional area of work. So over to you. Now, so before that, let me also introduce a brief. So AI is basically artificial intelligence and ML is machine learning. Computer algorithms are designed through machine level languages or high level languages, which are fed into the computer systems to build in system intelligence that is called artificial intelligence. So there is a lot of applications in healthcare right now that is going on. The basic application we can relate to is a CoWIN Arogya Setu app, which is Government of India launched it during pandemic. Over to you, Dr. Sarprasad. Please share your experience. Thank you.
Yeah. Thanks a lot, Pani, for moderating and introducing. It was a great introduction. Can you please allow me to share my screen?
Yes, please. So here you.
Yeah. I'm getting it. Yeah. It's coming.
Yeah.
Okay. Fair enough. So can anyone confirm that my screen is visible?
Yes.
Yeah, sure. So just a couple of corrections. Actually, Vani has gone through my the LinkedIn profile. So a couple of corrections. Currently, I'm working as a resident doctor, and I'm about to doing my MD in clinical pharmacology from University of Delhi. Last year, I was working with the PMO office as a consultant in the artificial intelligence and machine learning in healthcare, which is a great project, and that will be the prime focus where I will be sharing my experience. I am proud alumnus of University of Delhi, National Law School, and ISP. So proceeding further, so a brief disclaimer that this is a brief session. So we'll be discussing basic about digital health. And I explicitly state that all the statements I'm making are entirely on my personal capacity, and I'm expressing my personal opinions, and in no way they represent any kind of view of my employer, be it current or past. This particular, you can say, webinar will be primarily limited to talks related to AI ML in healthcare, focusing on the digital health. So the first question that we should understand that what exactly is digital health. So primarily, if we say digital health is a bigger set, having some subsets which include digital medicine and digital therapeutics. And going further, if I want to explain it further, so it can be any kind of technology or platform which can engage the consumers primarily in something which is related to healthcare. It can be related to lifestyle, it can be related to wellness, it can be related to prevention of anything. But the best thing about it currently is that no clinical evidence as such is needed. Whereas if you talk about digital therapeutics, then a lot of clinical evidence and real world outcomes will be required. We'll be discussing it in detail. So if you try to understand, see my sequence of presentation will go from global to India. Okay, so we'll be initially talking about what is happening globally, then we'll move to the Indian scenario, and I will be expecting the audience to ask me questions, especially targeting either Odisha, because I'm also a Odia, and simultaneously you can ask me anything regarding global perspective as well as the national perspective. So if you try to understand how the health scenario is different throughout the world, if we talk about USA primarily, it is very much driven by the private healthcare. Okay, whereas if we talk about UK, it is completely driven by the NHS. Whereas in Switzerland, it is driven by insurance, which are from non-profit providers. Okay, for example, in India, if you talk about, we have government insurances, we have private insurance there, but in Switzerland, we always have non-profit providing insurances. Okay, whereas if we talk about Japan, then mandatory health insurance system is there. Okay, similarly for Australia, universal public health insurance is there, which is financed by the government. So why it is need to be understood is that because a lot of expenditure that we make in our healthcare system is primarily driven by out of the pocket, especially in India. Moving further, now we need to understand that there has been a lot of change happening in healthcare in the last 1 decade. So there are multiple causes, but the prime cause, this is based on a survey done by Elsewhere, in which almost 3,000 doctors participated, and based on their interpretation, this data has come up. And if you can see, it is the COVID pandemic which has made maximum change in the healthcare ecosystem, whereas other changes includes driving being chronic diseases, aging population, then rise in mental health issues, simultaneously government policies and AMR. AMR is a big topic. I come from a background of pharma, and I can completely relate that nowadays AMR is picking up, and infectious disease, we all know COVID and stuff. Moving further, now we need to understand that when we talk about normal clinicians, most of our audiences are in India or might be abroad also. So we typically think that a clinician will be a person wearing a white coat, putting up a stethoscope in and around the neck and prescribing pills. That's it. But it's not now like that. When we talk about future physician, we need to understand that today the patients are a lot more empowered. Being a patient, you are starting nowadays to Google before going to a clinician. You're starting to have a second opinion. Simultaneously, nowadays, in the era of technology and social media, empathy is something which is very important. Soft skills like listening to the patients, being empathetic is something which nowadays is missing. And also due to lack of number of doctors, time is also a crunch. But now comes the next thing. What are the drivers of change? The driver of change being now patients are well aware about their condition. They are more informed. Simultaneously, due to the COPRA Act, patients are nowadays behaving more like consumers. Healthcare is nowadays a product, like a service. You're paying for it, you're getting the service. So nowadays, patient satisfaction is of paramount importance, especially in corporate hospitals. But when I try to talk about the future, how the future will be, so a lot of partnership will be done in near future with the patients. Simultaneously, patients are going to be becoming more empowered, and we will be moving to a phase which is called personalized care, primed by something called precision medicine. Now, what happens if you got fever in your family? Everybody is taking paracetamol 650 mg. Down the line, we will not be having that. The coming of pharmacogenomics, a lot of AI algorithms coming in place, and 3D printing coming up. A lot of you will be prescribed very much customized tablets. For example, someone getting 625 mg, somebody getting 630 mg, somebody getting 635. Currently, it's next to impossible. Okay. Call of action is there. We need to increase the level of literacy. We need to focus on the soft skills, both as patients as well as doctors. And simultaneously, the healthcare ecosystem also needs to improve. Moving to the next, we need to understand that now everyone needs to be tech savvy. It's not only the IT professionals. We as healthcare provider also need to be tech savvy. So currently we need to understand the digital era is already here. Okay, we already have a lot of data, overwhelming. But the issue is that we have an inefficient EMR. All of our corporate hospitals or good government hospitals are having electronic medical records, but maintaining them is a cause of concern, and a lot of frustration is there among the doctors. So the drivers of change includes, most important, I think, is COVID, undoubtedly. Simultaneously, with the coming of more and more data, and we now know that data is the new oil. So nowadays we're expecting that by 2025, that is within next 2 years, we'll be reaching a size of 181 zettabyte. You can imagine the humongous amount of data will be setting on. So the future clinician needs to be digitally transformed. They need to understand various digital health technologies. Simultaneously, they need to understand that down the line, 10 years, almost 60 to 70% of the consultation will be happening remotely, that is through telemedicine. Next, artificial intelligence. Nowadays, what is happening is that whenever you visit a clinician or a physician, they simply ask for your history, they do some testing, they get the reports, they make a diagnosis, and they prescribe you. Down the line, it will be not like that. Down the line, we'll be having algorithm in which there will be CDSS tool, clinical decision support system or tools, which will be in place. So these are something which are very important as future physician and tech-savvy physicians. Moving further, now the next question arises. Somebody might ask among the audience that Dr. Hara, you talked a lot about data, but where exactly this data is coming from? So we need to understand that data is actually coming from two sources. One is the hardware source and another is the software source. Hardware sources includes wearables. Nowadays, we are all wearing smartwatches. Some of you are heart patients or have some kind of replacement, joint replacement. Some of you are having biometric devices in place. So a lot of hardware tools are there. Data is coming from that. Next, software tools. Software tools, for example, you are operating some apps on your mobile phones. You're tracking your menstrual cycle. You're trying to track your nutrition, to track your calorie levels, your mental health, your stress level. So all those data. Simultaneously, there are big data lakes like the AWS Health Lake. I will be talking about further it. Now we'll be discussing something very important. This is the source is CBI Insights. CBI Insights has been doing a lot of good consulting work and will be discussing that how the big tech companies, the big five, that is Amazon, Google, Microsoft, Apple, and Oracle, are fighting a $11 trillion market of health technology. So primarily, if you try to understand that what exactly is driving big tech activity in healthcare, why they are so much interested, the first point is the consumer demand. After the pandemic, everybody has realized that prevention is the best thing that we need to do. So everybody is looking easy to access services and technologies and simultaneously expecting a very good experience in terms of consumer driven user interfaces and experience. But the problem lies is that currently our healthcare infrastructure, especially if I talk about Odisha or I talk about even in India, though different states have a different ecosystem of infrastructure, but I will definitely say that no state in India has a complete integrated system in place. We have a fragmented system in which we have the diagnostics separate, we have the OPD facilities separate, and simultaneously lot of paperwork happening, lack of digitalization. That is resulting a frustration among the patients or the consumers, you can say. Simultaneously, next driving force is the high administrative burden. We all know that there are a lot of manual and repetitive tasks that the admin needs to do, which can be automated. So there is a demand from that side. Next is the demographic pressure, which is the fourth and last important point. So as you know that our population is now world's largest population. We are the biggest democracy and the largest population. With tech companies now, for them, we are the biggest market you can think of. So primarily we'll be discussing 4 important companies. Oracle is something I don't want to much discuss because it will be out of our purview. Moving further to Amazon, what exactly they are focusing on. So Amazon is primarily currently focusing on capturing the provider market. So there are 2 markets. One is the service or the consumer market, another is the provider market. They're capturing that. Secondly, they are nowadays expanding into something called precision medicine. In my previous slide, I talked about something called personalized care, in which I gave an example of prescribing paracetamol at different doses. Third, they are focusing currently is something called connecting consumer tech for health, getting into the wearables. You all know of Apple Watch. They are creating something called Halo. We'll be discussing. So this is something, what kind of acquisition they have done, what kind of investment portfolio they have. So you can have a look, and if anybody want, I can share the slide deck also. This is something I wanted to discuss. If you remember in my previous slide, I talked about Health Lake. So Amazon is clearly working on something to build, which will be dominating the next 10 years. That is precision medicine. With Health Lake coming up, it will be a one-stop destination for the development of any kind of treatment related to precision medicine. For example, there will be structured as well as unstructured data, which will be used by Amazon Health Lake. They will be using tools like natural language processing. They will be following high quality industry standards of healthcare. Simultaneously, there will be ontology mapping. I don't know how many of you are from computer science background, but they will be doing ontology mapping as well, followed by a search query using the SQL tool. And down the line, they'll be using it and they will be selling it to different third parties also. Remote monitoring. I think some of you have used in some form of remote monitoring in past or recent times, especially during COVID. So that is something catching up. And I just mentioned about Halo. Halo is like a watch, a wearable device. They are competing now with Apple Watches. But the best part is that Halo has now a lot of partners. You all know of Headspace, which is a meditation app. And simultaneously, there are other partners they have collaborated with. So Amazon in done and dusted. We'll move now to the next big thing, Google. Google has got a different strategy completely in place. Google is building a life science brand. I'm personally super excited, and I hope that down the line, I might be contributing something in this space, and I'm very super excited about it. I will tell you some of my publications and research work is aligned in this direction also. Next is that they're creating something which will work as a search engine for healthcare. You all know of chatbot, you all know of ChatGPT, we all know of Bard coming up. A lot of large language models are talk of the town nowadays. Simultaneously, they are working on the wearable. See, wearable is something everybody is banging on because there is not much regulation in place. So everybody is trying to take their share of pie from the cake. So this is Google's portfolio. If you see, investment is majorly in smaller companies and partnership with bigger pharma companies, Sanofi, BI, big pharma companies, they can't purchase as of now. But yeah, definitely. And if you see the AI, and medical data, everywhere you'll find that. Two spaces I want to talk about is the drug discovery space and imaging space. For the next 5 years, these two spaces are going to be completely disrupted. Pre-COVID, a drug discovery used to take 10 to 15 years. But believe me, due to COVID, a lot of collaboration happened, a lot of guidelines and regulations were relaxed, resulting in the fact that drug discovery nowadays can be done in 4 to 5 years. Vaccine has been done in almost 1.5 years. So you can imagine the kind of progress we are making up. So this is something very exciting. If you talk about Google, it has invested strongly in Insitro, which is working on discovering of drugs. Radiology, they have collaborated and partnered with Varian and real world evidence. Some of you might not be aware, so I want to give you a perspective. So what is exactly real world data? So a lot of time we want to mimic a data set, or we want to make a data set which is similar to the real world data, but we don't have that. So for that, we need someone who can generate that data going on ground and simultaneously implement that and create an algorithm. This is the whole process. And I hope you will getting a good insight from that. Microsoft, the big tech company, they are working on a different side of health technology. They are working to create coating enterprises of software developers, primarily investing in health IT. Simultaneously, they have something called Azure, and they are now increasing Azure's capability, and they are targeting something which other companies are not targeting, that is cybersecurity and privacy. This is how Microsoft's current portfolio looks like. Innovaccer, it is an Indian company, and we all should be very much proud of. It is a unicorn now. Few of my seniors, medical seniors, are currently leading this company, and I'm super excited about this. CVS Health, Teladoc, Cognizant, these are usual companies, but this is something you all should watch for. The next big game changer from India is coming up for the world. This is something I wanted to discuss. I mentioned that Microsoft is clearly focusing on healthcare IT. These are some of the companies they're either investing or going into acquisition. For example, Nuance, they have acquired now. Something Microsoft is doing little bit of, I must say, is that they're focusing a lot on AR, VR technology. We all know augmented reality and virtual reality, especially, see, I have finished my MBBS and I completed my surgical training on human beings, live human beings, but it's not practically possible for everyone to do, because we don't have that much of humans as patients, or we can't commit errors on live patients. So that is very important. And HoloLens is coming up in this scenario, and these are some big hospitals which are partnered. Recently, I visited Apollo in one of the conferences, and Apollo is proud to announce that they have also partnered with Microsoft, and they are also getting into HoloLens business. That's very exciting, especially if you think about India. Azure, I mentioned, Azure is something Microsoft is strongly banging upon, especially for working on the data sets. They are creating very much structured data, working on the imaging data, path reports, and this is going to be super exciting times ahead. Moving further, you all, I think some of you might have heard that back in November, December 2022, there was a cyber attack on ICMR followed by AIMS, and there was a lot of hacking happening at that time. So you can think of that if the digital data is there in place and the hacking happens, then it will be a breach of privacy of both the patients as well as the regulating bodies. So Microsoft is working on this direction, and I am hopeful that it will be a game changer also. This is some of the portfolio they're investing, especially for cybersecurity. Yeah, this is something which needs to be understood, and I want all of your focus now on the board. See, whenever we talk about AI and ML, it is a very fancy term. Everybody nowadays says that I'm an AI scientist or I'm a data scientist, something like that. But we need to understand that end of the day, we need to be ethically correct, and we should do explainable things. So these are the basic principles which we call responsible AI. Whenever I'm talking about ethical, it should be inclusive in nature. It should not bias between rich and poor. It should not be biasing among white and black people in colored skin tones. Whereas, as well as it should be accountable. whatever the AI algorithm is saying, it should be accountable for that. Explainable means fairness, transparent, private, as well as security concerns. But there is a gray zone. You can see a common area. It should be reliable as well as safe. Apple is something I have been always fascinated, especially the kind of small company it is, but the kind of bigger impact it creates. They're working on centralizing health data, as well as they're combining the clinical as well as the consumer needs. Here, see, in the healthcare market, when you talk from a corporate word, they called it consumer, but for a physician like me, it's patient. Okay. This is something super exciting, and I hope that you all know of. There is a health app, Apple Watches. All the iOS users specifically use it very commonly, and currently they have incorporated 51 features. Man, it's very big. They have included activity, lot of type of activity, sleep, mobility, heart health, mindfulness, women's health like period cycle tracking, cycle development, other stuffs, and medication also. Now it is a part of that. Hand washing, safety, basic research work. You need to understand that when these kind of data set are there, then super kind of research will be happening down the line. So they have now Apple Heart and Movement study, how you walk, how your heart pumps, what is the beat coming up, how the woman's body behaves, what is the menstrual cycle happening. Now also Apple has collaborated with WHO, and I am a part of this project in which they are using hearing study. They are tracking your voices. For example, currently I'm working on a project. You will be very happy to know that from coughing sound, we can predict that how much chance is there that the person is suffering from tuberculosis. So you might imagine that there will be so much affordability and so much easy accessibility. We all come from Odisha. I have never visited Kalahandi, but I know that a lot of tribal areas are there in Odisha specifically, which are very remote. So if we can put a PHC person going to Kalahandi or a very tribal district and putting up a smartphone, having an internet connection, and just asking the patient to cough off. And by using that sound, we can predict that how much chance of TB is there. You can imagine the kind of impact it will be down the line. Hope it sounds convincing. We all have grown up listening to this, that an apple a day keeps the doctor away. But I must say the moment currently Apple is doing, especially in tech sector, primarily focusing on the wearable and the kind of research work, data gathering it is doing. I must say this saying, if I talk about the apple, the fruit, is absolutely correct. But the apple, the tech company, is always with the doctors. Now we'll shift to India. We talked about global perspective and now shifting to India. So we need to understand that what is the current problem in Indian scenario. Okay, so currently we are a lot of hospital-based ecosystem. We are a lot of reliant on doctors. A lot of financing is happening. We are more dependent on episodic approach. Whenever we have some problem, then only we visit a healthcare facility. Then only we seek opinion. But down the line, things needs to change. Currently, it is hospital-based. Down the line, it should be community-based. Currently, it is facility-based. Down the line, it should be patient-centric. And most importantly, currently, it's reliant on the doctor. Down the line, it should be patient actively managing their own health. The accountability should be with the patients. This is very, very important, and I hope you all must be convinced by this. In the last 5 to 6 odd years, a lot of progress has happened in Indian healthcare ecosystem. And I'm proud to say that since my first year of med school, I have been part of this, and I have worked for Apollo, I have worked for Max Group, and I have worked for PharmEasy also. So 3 big brands I have worked, and I have seen how the things have progressed, and we all should be proud of that. So this is a model in which we talk about how the healthcare ecosystem in terms of integrated health, aggregator business, service specific, and healthcare provider looks like, and you can have a look in your free time also. We all have been listening about e-commerce platform, Amazon, Flipkart, Nykaa, Snapdeal, a lot of. Now we are talking about e-commerce platform for healthcare. Online pharmacy, they have increased tremendously. You think about PharmEasy, you think about MedLife, you think about Apollo 24/7, humongous increase in the demand. Online physician consultation, think about Practo, think about Meadow. A lot of companies in the telemedicine sector have come up. Similarly, for e-diagnostic, this is something picking up, and I'm also hopeful that with genomic testing coming up, Mukesh Ambani now has also jumped up into genomic kit business. So this is also going to catch up soon. You'll be ordering tests at your home, and you'll be doing by simply a rapid test which you used to do at home, or like a urine test for pregnancy detection. It will be that simple. Imagine the kind of change we are going to witness in the next 5 years. I'm super excited about it. Uh, Next thing, that how people have adopted to the change scenario of doctor consultation. See, I come from a non-medical family. I was born up in different parts of India because my father has a transferable job. But I lived with my grandparents also. I have lived with my joint family, and currently I live in a nuclear family. So I have seen all age groups, and oftenly when I interact with people, I often see that 40 plus have a very rigid personality, and they are not that much adaptive to smart devices. That's why you can see the lesser number of acceptance in this age group. Whereas in the younger generation, it's quite easy adaptability and adoption to telemedicine. This is how different cities are behaving. Tier 1, you know, the metro cities, tier 2 and tier 3 you all know of. So little bit difference is happening. I don't have reasons specifically for this, but yeah, this is something which my team is also looking at, that why tier 3 e-diagnostic is catching up. I don't have answer to this. Digital health to the patient type. This is super excited and super important slide. You need to understand that why digital technology and tech companies are, or even startups. I have worked with a startup in recent past, which are primarily focusing on hypertension. Why? Because it's a chronic disease. Why? Chronic disease is more profitable because the patient will be on a medication for a longer period, and the patient will not change the medication often. So you just need to nudge the patient कि आप दवाई ले लो, अपन out रे medicine नहीं नियो तो time रे नहीं नियो तो something like that. So it's very important, and that's why you can see that all the bars are higher, or you can say bigger in size in the chronic patients. Post-COVID, a lot of change have happened. In my first slide, I talked about that what are the biggest drivers of change, and if you remember, it was COVID, and a boom has happened tremendously. I remember pre-COVID, there were hardly few health tech startups. Now it's a very, you can say, booming and happening space. This is the key pain points various consumers are facing currently. Wait time is a little bit higher. Need to visit the facility, travel time, price transparency is a concern. You visit a physician in Cuttack near SCB, there will be a lot of doctors sitting together in the sense one after other. But pricing, there is no transparency. Reporting is also a cause of concern. You might be expecting a report tomorrow, but you are said that it's not done. So that's why we need to go to the next big thing, that is the digital health and stock options. That is a lot of time logistic challenges are there. Medications are not available. I have my uncle, you can say Udiya mein hum bolte hain Koki, who lives in near Keonjhar. Okay, he's a mining engineer. I remember that whenever he asked me for any medicine, Dr. Hara, I want a medication for this, and I examine them online and I prescribe medicine. Most of the time, what happens is that in their area, the medicines are not available. And that is a very big challenge for me. Sometimes my other relatives have to send medicines from Bhubaneswar. So these kind of things will change very drastically once digital health penetrates, just like the internet has penetrated to the grassroots. This is something customer reasons we can think of, especially why they are trying to remain on the digital platform. See, the payment option is very easy. हमें हमारे पास वो खुद खुला पैसे की जरूरत नहीं है. We can do credits also. We can choose our own physician. Home care is available. Easily ordering the medicine is very important, and it's very easily doable. Simultaneously tracking the medical records. आप सबने देखा होगा, मतलब in recent times whenever I ask a patient कि आप मेरे को अपना last 3 years का अपना वो दिखा दो lipid profile, if the patient is suffering from fatty liver, तो उनके पास होता ही नहीं है, और अगर होता है they will look into their almiras and stuff. So if we are going to in a digital mode, this will be very super simplified. Then going to the next big thing, that is the integrated applications. So we need to understand that integration, we can't function in silos. हम एक दूसरे को collaborate करना पड़ेगा, and everything needs to come together in a very collaborative manner. Then only things will fall in place. This report was published by Arthur, and this is the insight from a focus group discussion in which they have classified that how the integrated application preference looks like. This is the color coding, and you can have a look. Yeah. So you can see that self-testing kit, health advisor, therapeutics, these are currently weaker zone because currently the awareness in Indian population is not that high. But I can definitely say I practice in Delhi. I can say that in higher income groups, for example, people working in IT sector, people working in blue collar and white collar jobs who are earning say 80K plus per month, their understanding regarding these three things are a little bit better compared to lower socioeconomic group. But I think down the line with awareness catching up, this will be not a big challenge to do. Moving further, see, I have grown up listening to this fact that India is a poor country. I Just to bring a perspective, when I joined MBBS first, I was allocated SCB Medical College in Cuttack. Then down the line, I shifted to University of Delhi for my MBBS in the further round of counseling. I still remember in those days, people used to say that Odisha is a backward, India is a backward country. We are lying behind. Technically, US is ahead 10 years from us. Okay, but believe me, with last 4 or 5 years of progress the IT has made and healthcare has made, now we are neck to neck with the top, you can say, developed nations. The best example I can quote is of COVID. Okay, left hand side you can say that how the vaccine recording happened in US. Simply just like a postcard, there was a vaccination report card they mentioned. Okay, and America ridiculed India for having COVID in the initial days. Now it's very difficult task for them to make their citizens understand that they need to have this paper card in place, otherwise their passport and visa issues will be there. Whereas India created something looking at a very long perspective, the COVID global the COVID. And in the COVID global conclave, our PM declared that it will be made open source and now available for all countries to use. So COVID is something I personally am very proud of. And next big thing I want to discuss is the ABDM and NDHM. So when I was working as a consultant AIML in healthcare in the government of India, I got a chance to lead a lot of these. So you must be knowing that we have something called ABHA ID nowadays in place. ABHA stands for Ayushman Bharat health card. So ABDM stands for Ayushman Bharat Digital Mission, NDHM stands for National Digital Health Mission, and there is a body called NHA, National Health Authority. So you can relate it to Aadhaar movement of India. Okay, Aadhaar came up, a unique ID came up, bank finances, everything, the corruption level decreased, everything was made accountable. The same thing is going to happen in India now with UHI coming up. There will be ABHA ID, which all of you will be getting up and you can create. Now it's open. A lot of people have already made that. As far as I know, almost more than 25 crore health records have also been linked with ABHA. So it's a big thing. Simultaneously, today I was going through the news and I was super excited to learn about this, that Bill Gates today said, it is today's, okay, Mint, live Mint I was going through. Bill Gates today said that world should learn from digital systems India has created for healthcare. It's actually a big statement coming from a tall, stout, a very visionary person. You must know that Bill Gates is not someone who is only business minded. He is a leader and he has a lot of vision in place. So a statement like this coming from him, and he being he's not an Indian, okay? So he's not a Sundar Pichai, or he's not someone NRI who will be doing to praise the Indians. But coming from an international, big, tall, stalwart person is a big change. Okay, we can have a large discussion if the panel wants or the audience has a query. But moving further, so I will just enumerate that how the ABHA is working, how artificial intelligence, machine learning is coming into in picture. So if you try to understand ABDM is currently having three things. ABHA will have the patient number. Okay, you will be getting as a patient a unique number. There is a health facility registry. For example, if I take example of Odisha, we have three major big medical colleges. Okay, older state medical colleges, SCB Cuttack, Burla Medical College and Barampur Medical College. So, for example, all of them will be getting a number. The Capital Hospital in Bhubaneswar will be getting a unique number. The High Tech Medical College, the AIIMS Bhubaneswar, they all will be getting a registry number. Whereas all the doctors, they will also be having unique numbers. So now everyone will be accountable. The patient will be accountable, the facility will be accountable, the care provider will be accountable. And there will be two categories. One, health information provider and health information user. You all know of, there are a lot of doctors will be providing, there will be diagnostic center, there is a health locker. These are nowadays called HIP, whereas all those will be using that information. Doctors will be using, okay, citizens will be using health locker, so they are called HIU. So this is a very good thing coming up, and this thing I will be explaining in a bit. So if you try to understand, this is on the left hand side is the older, you can say, current platforms, and this is the ABDM platform looks like. So what happens, I will relate it to the UPI movement of India. Okay, if you remember, currently what we are doing, whenever you visit a shopkeeper, you only scan the QR code and you can do the payment. Remember, just try to recall, in recent times, we didn't had this facility. If you are a Paytm user and the shopkeeper also uses Paytm, then by default you have to pay only through Paytm only. You can't use Phone Pay or Google Pay, right? But that bottleneck currently, you can say, was completely changed when unique QR code UPI came into place. So with ABDM, this is not going to happen. There will be interoperability happening. Anybody can communicate with anyone. There will be open protocols in place. Here, what was happening? There was a proprietorship and there was a lot of patent issues and happening. So this was platform centric model, whereas it is open network model, ABDM. With ABDM coming up down the line, health insurance will be cheaper and it will be more, you can say, happy for the consumers also, because you all know of claim acceptance rate is poor in India. A lot of time you have a 1 crore bill and you have a 2 crore insurance. You think that my insurance will be paid. Sorry, my you can say health bill, hospital bill will be paid by the insurance company. But then you realize that there are some challenges coming in place. So with all these coming up, it is going to be a big changer in the claim exchange process also. This slide is something I want to share my personal experience to some extent. See, whenever something happens big, then you need a lot of collaborations. Okay, for example, when I was working as a consultant for the PM office in the government of India, I was collaborating with a lot of startups. I was collaborating with a lot of MNCs. I collaborated with academia. I collaborated with faculties. I collaborated with chartered accountants. So that level of collaboration is needed to remove any kind of bottlenecks and any kind of roadblock that is happening. So this is something I want to focus, that being Odiyas or being Indians, if you want that we should progress in a very fast mode, then this is a need of our, okay. We need to collaborate both at a global level as well as in the PPP mode. See, now my focus is going to be that how the financing looks like. I have been looking up to things in recent past, in which I worked with the W Health Ventures as one of their consultants, advising them on some health portfolios. And there the thing is that when I was working for them, we realized and we come up with a report. I'm just going to showcase some part of it, and it is publicly available. This report, you can have a look in your free time. So if you try to understand what is currently happening is that almost currently there are startups, and you often listen this, that startups are closing also. Okay, so if you try to understand, in India, nearly 5,583, almost around 5500 startup closed, in which 225 were health tech startups. Similarly, in 2021, the number was 104. But if you simultaneously try to understand the acquisition, we already have gone through a previous slide in which Amazon acquired few startups. Okay, I have personally known Filterfly. Filterfly is in the diabetes space. Amazon has currently invested into it. Down the line, it might be acquired also. So acquisition is also happening in this space. If I talk about talent, okay, currently we have a very good, large tech talent in India. And I practice in Delhi. I work in startups also, and I can vouch for this that in Gurugram, in Bangalore, you will find fabulous Indian talents. I know Odia people, Bengalis, South Indian people working fine, and they have a very tech in their DNA. They have a startup entrepreneurial mindset in place. But the challenge is that there is a lack of ecosystem and lack of proper encouragement, a lack of a structured pipeline in place. which I am hopeful that with the current government in place, both in the center and the state, they will find out and figure out something. That is the only challenge I can think of. Next, I want to talk about the omni-channel. Omni-channel is the new age models that everyone tries to build up. D2C brands will definitely continue to move, and they will be moving to offline stores also. And simultaneously, as healthcare startups, we need to understand that while providing healthcare services, we need to identify some touch points. What are the physical touch points? And we should partner them with the legacy provider and opening offline clinics. For example, 1mg was acquired by Tata. Okay, after acquisition by Tata, there is a trust. Okay, Tata is a brand in India which is available from salt to aeroplane to Tanishq to jewelry to banking business, everywhere, from insurance, everything. So that's the kind of trust that comes up. Next is the proliferation of vertically integrated care platforms. Okay, I just mentioned about FitReply, it is in the diabetes space. I know a few startups also in the women's health space. So three spaces currently. And if you remember, I mentioned that chronic diseases are a focus area for all the major startups because the return of investment is quicker and faster, and the success model is also easily doable, also replicable to a great extent. Down the line, just I mentioned also in my previous slide that patient experience is going to be paramount importance. We need to deliver results with proper credibility, with proper accuracy, which was not a talk of the town in the past. These things will be changing, and down the line, I must say that India should look forward, and young people like me and all the listeners should go forward and work in this direction, that what is built in India should go for the world. Take the example of COVID. I mentioned about Innovacer. I mentioned about Indegene. If you remember, I mentioned that Innovacer, my few seniors are there. They're working superbly, and it is now a unicorn. Indegene is also a great company. So these things will be talk of the town, and hopefully in the next 2 to 3 years, we'll have a lot of startups which are working globally as a big brand. If I talk about tech giants, I have covered in detail, but Meta is coming up nowadays into WhatsApp. They have WhatsApp in place, so they are running a digital health startup incubating program. Google Health, the parent company Alphabet, is also working on the heartbeat, murmurs, respiratory rate, a lot of wearable technology, okay, and working on the diagnostic workflow. This something, so Alphabet, the Google, I mentioned about you regarding Apollo. So they are currently also working with Apollo Hospital Group to create a diagnostic workflow. Some of you might be aware of now Apollo is coming up with CIE, Clinical Intelligence Engine. Apollo 24/7. I'm also a part of their advisory board and have been working in some of the projects. So this clinical intelligent engine machine will be like a tool which will help the doctors to predict the diagnosis at a very faster rate with more accuracy, lesser time interval. And this is going to be definitely a game changer. A lot of people and my colleagues also say that, Dr. Hara, currently there is a funding winter happening. There is lack of funds, but I don't think so. Personally speaking, a lot of fund is there. You just need to have the right mindset and the right slide deck and the pitch mentality, that what you are exactly claiming of, and you should have a right value proposition. The investors are ready, okay, anytime. Now I will focus on my work, recent work. So the moderator mentioned this is one of my papers which got published in Frontiers, in which working as a government consultant, we predicted that how much faster we can predict COVID surges. Okay, this was appreciated at WHO level, and also this was covered in the Hindu. You can have a detailed read of this sometime. It is called Strain 4 model. This is now replicated in Stanford and Harvard also. They're looking into our paper, and you won't believe we spent somewhere around 5 lakhs maximum in this whole project, and US, UK, they spent crores of rupees to create something like this, and still we are better than that. That's why I was telling you, I'm very much hopeful that the young Indian blood can do tremendous work in your future. I have been working with a lot of partners. So Triple IT Delhi has launched something called Wash Karo. I was part of that. Currently, I'm working on a super exciting project that is called deriving the real world evidence. I was talking about that in a previous slide deck. We are collaborating, working on some few projects on that part also. This is my book. Yeah, I think most of you must be knowing Dr. Achyuta Samanta, KIT Foundation founder. Dr. Ashok Kumar Mahapatra, who is a famous neurosurgeon, and he's currently leading the SOA University. Dr. Gagandeep Kang, a famous microbiologist, well-known scientist in the ecosystem, and I'm proud to say that I am the first person to write this kind of documentary, and a proud Odia also. I apologize, it's not Odisha, it's Delhi, because at that time I was practicing in Delhi. But you can have a definite read to this book and you will love it. I have covered in detail in a very medical jargon-free language that you can understand very easily. Uh, Personally, I have a lot of belief on Lord Jagannath, and I just want to convey that success is the progressive realization of how many people are better off because you exactly lived. A lot of time you'll have questions in your mind that whether I should go for money, compromise on my ethics. But I definitely will say that have your ethics in place in the longer run. That only counts, and that kind of success you should look for. Chat GPT, modern AI, a lot of things, job loss you all talk about. But see, this is a person called David. Okay, he created a humanoid Sophia, and he simply said, don't fear AI, only try to be friend of AI. Okay, so the famous terminology, or you can say statement we make in the medical arena is that down the line, doctors who use AI will replace doctors who don't use AI. Similarly, I must say that in all the verticals, be it IT, be it banking, be it education, those will not be using AI will be replaced. AI will be like a part of our life. Nowadays, we oftenly use smartphones, laptops. It will be something like that, that much use common. Chat GPT, people talk about. Chat GPT will be like the Google search engine we are so much commonly using. It will be like that. So hope it makes sense. This is one of my conferences in which I attended recently in my last year. People from Oxford, people from Cambridge. I'm lucky to be a part of this kind of conference, and we brainstormed a lot. And you just see the kind of work we are doing. This comes from these kind of collaborative efforts. This is my last year's winter school. I was selected from Princeton and Ashoka, and lucky to be a part of great faculties and great colleagues. This is my mentor, Professor Sanjeev Arora from Princeton, USA, and he trains me on computational part of my training. I'm also trained in computer science apart from my medical training. The Sardarji is my mentor from India, Dr. Taprite Sethi. He is the chief digital person working for Indian government, and I'm lucky to be mentored by him. This is my team when I was working as a consultant. And these are my collaborations and associations. Down the line, you can see my educational institutions. In the midway, you can see my startups from which I have worked in recent past. And in the top, these are the research institutes and research collaboration currently I'm working on. These are my social media handles. You can reach out to me on Gmail or drop me a text, hi on LinkedIn. Happy to connect anytime. That's it from my end. I hope I didn't bother you much, and uh, hope you're comfortable on that part. Yeah.
Thank you very much, Dr. Hariprasad. You have covered most of the applications of AI and ML in healthcare. I will open this webinar for the participants. Please ask your questions.
Sure, I can share the PPT. Already, I have shared my PPT with one of the persons from the foundation, uh, uh, and I will connect with them also that they can share it to you anyway. Happy to share. Yeah, no issues. Can you touch upon mental health related issues? Yes, I touched briefly, but I hope you understand that I have only 45 odd minutes. I can't cover everything. But yeah, a lot of digital therapeutic interventions nowadays are coming up, especially if I talk about Headspace and a lot of tools I personally know of. And in the mental health space, if I talk about sexual health, is also a part of that in terms of psychiatrists primarily also dealing with the sexual and wellness products. So we can have a chat offline. You can connect me on LinkedIn, and we can schedule talk on that part. Yeah. I think Uday wants to ask anything. I request the moderator if they can unmute Uday.
First of all, thank you,
Hi,
Dr.
hi.
Hora, for this enlightenment session.
Yeah.
So,
Thanks a lot
so
to that. Yeah.
yeah. So we also work in this primary healthcare sector. So as a startup. So anyway,
Okay.
so couple of things. I will first thanks on the genome surveillance thing and the Delhi Corona Fight books. So
Yeah.
thank you so much for that. And okay, two questions I have for the timing. One is on the policy, government policy on the compliance perspective. So if
Yeah.
I remember into 2021 April, we had a guidelines, but I think we
For
don't have a
telemedicine?
policy in place.
For
So can you
telemedicine?
throw a little light on the Yes. Telemedicine practice. We had a guidelines which was published, but it is not a proper policy
Yeah.
or documents to my understanding.
Agree.
So,
Yeah.
so are we expecting something in the near future? Because like HIPAA compliance of US and everything, do we have something coming up? Or the reason being, we also need to align with that today. Like we talk about ABHA and this HSPs and UHIs. So,
Yeah.
maybe sometime I will request the moderator to organize one to understand a little bit more on the UHI and as a HSP.
Definitely happy to do that. Yeah.
Yes. On the government policies, can you enlighten us?
Yeah. I'm coming up. So just give me 1 or 2 minutes because I need to elaborate a bit to make you understand. See, when COVID came up, actually telemedicine is not a new concept happening. Okay, if you remember during our childhood days, you used to call your family doctor कि बता दो कौन सी medicine ले ले, वो बोल देते थे azithromycin ले लो, या फिर WhatsApp पे कर देते थे, या फिर message आ जाता था, something like that. It used to happen. But during COVID, what happened is that they wanted some policy in place. तो हमारी एक there used to be a telemedicine society of India. तो गवर्नमेंट ने हम लोगों को बोला कि वो टेलीमेडिसिन सोसाइटी से ही गाइडलाइन बनवा देते, तो दैट वाज मेड. बट प्रैक्टिकली स्पीकिंग दैट वाज नॉट इम्प्लीमेंटेबल. अगर आपने देखा होगा उसमें काफी सारे लूप होल्स हैं विच कैन बी एक्सप्लॉइटेड. कुछ ऐसे एरियाज हैं जहाँ पे प्राइमरीली इफ आई टॉक अबाउट दे आर वेरी मच स्ट्रिंजेंट, एंड देयर आर फ्यू एरियाज व्हिच आर वेरी मच यू कैन से देयर आर लॉट ऑफ लूप होल्स. ओके, फॉर एग्जांपल काफी ओपन एरिया है. तो फॉर एग्जांपल साइकेट्री डिजीज है, उसमें काफी ज्यादा स्ट्रिंजेंट कर दिया है. वेयर एज अगर हम देखें चाइल्ड केयर मतलब पीडियाट्रिक पेशेंट्स में उनकी लॉज काफी रिलैक्स्ड है. देयर आर लॉट ऑफ लूप होल्स इन दैट पार्ट. So that is something which is a cause of concern. But yeah, with NDHM coming in place, I can guarantee that I will not say it publicly, but yeah, something is going on in the background, and you can soon expect probably end of 2023 or starting of 2024 prior to the elections. That I can say. Yeah.
But do you think it is going to something as a mandatory things for HSPs kind of thing? Okay, so basically what you're suggesting is let's align with him first.
Yeah. So I will tell you in this way. See, I come from a legal background also. I did my training from NLU. The reason I did my training in the legal background, I wanted always to understand the regulatory part of things, because otherwise as a doctor, you can only understand whatever the lawyer says. I need to understand what the law tries to mention. So the perspective is that if you remember when Aadhaar was introduced, everybody said that creating an Aadhaar ID is a voluntary measure. But you also know that now nobody will say that Aadhaar hi de do, but you also know that without Aadhaar surviving in India is very, very difficult. Hope I am trying to make it clear.
Got it.
Similarly, government will not mandatorily say in the public that you have to be compliant, but it will incentivize so much that if you don't do it, then you will be losing a lot and you will be out of the product, because interoperability is a cause of concern. You can't operate with their system in place. So I will request you that it's high time you should align, because when I was working in 2022, 2021 as a consultant, at that time Tata 1mg and other big startups were aligning. Now it's almost every single small startup is aligning, so better you align. Yeah,
great. I think you have also made it very clear, doctor with AI and doctor without AI, so that's where the things will fall.
And that's valid for every part, I must say. It's not about doctors. This is a very healthcare driven conversation. But I am a person, if you talk me offline, sometime I can speak to you on any topic. I'm happy to connect. Yeah.
Good to hear that. Okay, thank you so much. Maybe.
Yeah, absolutely. Uday, you can reach out to my LinkedIn. Happy to connect and discuss.
Sure. Thank you.
Anyone else? I can see some chats. Yeah, I will just share my LinkedIn on this chat also. And meanwhile, Uday, I think you want to ask something.
Yes.
Yeah, sure.
One more question on the, as you mentioned about the Google wearables and all this thing coming up. So there are a lot of wearables nowadays. So,
Yeah.
and if I look at it, the clinical relevance of those
Agree.
data
Yeah.
outputs, how do we look at it and how do we take it?
Yeah. So see, I will tell you. So currently what is happening is that I will compare it with nutraceutical products. Okay. You must have seen whenever you visit a pharmacy store, you get a branded vitamin D supplement and also some local brands also. Okay. But it's always a trust issue happening, that whether you'll go for a branded generic drug or you'll go for a Jan Aushadhi wala drug. Similarly, this thing is going to happen. Apple watches, everybody can't afford. 2000 or 1500, the boat watches, other small noise company are coming up. If I talk about exact relevancy, currently Apple, you can rely to a great extent because they have large clinical trials already in place. And I think you must have heard in news that a lot of people with cardiac history got alarms also. So I'm not a supporter of, you can see I don't use Mac or iOS products, but in this thing, I must say, that's why I mentioned that an apple a day keeps the doctor away. That story is not going to capture here. This apple is very big, and because they have specialized in one product, you all must be understanding that I have covered a lot of things. I focused on big tech companies. The reason was very simple. I wanted to show that what they are exactly focusing on, because end of the day, the game is very clear where the tech companies will move. Government will move the regulation towards that side because the business model is that only. And hope it's loud and clear.
Yeah, got your point. Thanks for that. So basically, why I'm asking this question on the primary healthcare perspective. So what the process we are currently following is, one is the device. The device is very important because the parameters which we are taking has to have clinical relevance. To get the device onboarded into our systems, what we do is two things we do. One is it has to be approved, let's say BIS certified or CTRI, the regulatory, it's the things will be there. And the second thing what we do is we get it calibrated at a NABL certified labs at a regular interval. So to make the parameters data, the data has to be very relevant. Otherwise, gathering data is one part and working on not clinical relevance data will give us a little different direction. So we want to cut it down at the very first stage itself. So
agree.
So that's why we were in a little dilemma. There are two perspectives to it. One is a clinical perspective. Second is the way where the things are moving. The way you told the big giants are moving, definitely the policy will align to that. And slowly I understand that. Slowly they will also come up with that, which will have a clinical relevance in place. But today, so people will be a little apprehensive if I go and do test at home and if I go and take a test in the SRL lab or some labs. So there are two. So you know the psychology of those things.
So I can comment on this way that see, I will tell my example. When I moved to Delhi back in 2012, I was in class 10. Okay, at that time, now you won't believe in our home, hardly per month each e-commerce shopping will be like maximum 10K per month, not more than that. But now you won't believe everything from a needle to a cloth to everything comes from e-commerce. Okay, we don't visit stores often. So that level of trust will happen. That will take a due course of time. Yeah.
Anything, acceptance, cloud or even the banking, it also goes the same way. Internet banking नहीं कर रहे थे, so अभी का हमें इतने comfortable लेने से हमें उन्हें चाह पी ले भी से नहीं दे दूँ आराम से.
बिल्कुल.
Okay, thank you. I will leave this for other people to question. Sorry.
If any.
Simple है.
More questions? Okay. Are you there?
Yeah, I'm there.
Yeah. Okay. So telemedicine is the area where future of health can look into, and it has big and all. So can you please touch upon more in few lines how telemedicine will actually improve the future of healthcare.
Okay, fair enough. So see, currently what is happening, one is that we are only focusing on telemedicine in which the doctor consultation is happening. Okay. For example, I'm in Delhi, somebody from Odisha wants to consult me, and they're dialing it up on a platform. But with NDHM and ABHA coming in place, can I request the moderator to mute the audiences because it's getting a little bit disturbed, if possible. Otherwise, I can continue. Yeah.
Other participants, please mute yourself, mute your phone.
Okay.
Only speak
yeah.
when you-
Actually, I think I have muted, so it will be fine. Yeah. Sorry for the interruption. So I was saying down the line, what is going to happen? One is that once NDHM and ABHA, everything is in place, then the regulation will automatically come in place. For example, what happened in the UPI space, Uday and me were discussing now about the finance part also. So once that is in place, a big, you can say, rapid spike will come in terms of adoption. Currently, see the concerns what are there. For example, say a female patient is there and a male doctor is there. In the physical examination, it's possible that I can ask for a female attendant to be there while I'm examining a female patient. But in teleconsultation, these challenges are a big challenge. And also the recording problem, because a lot of our guidelines currently say that you need to record the meet. But a lot of patients are not comfortable for that, and a lot of time doctors are not comfortable for that. So that is also a gray area of concern. And I personally feel once ABHA and everything is in place, once there is a unified, integrated platform, then e-pharmacy, diagnostic, and telemedicine will work hand in hand. And that will work as, you can say, a very big game changer and disruption, especially in the far-reaching peripheral areas. To give a small example, UPI, YouTube, all this happened, but it was driven by Geo. Not exactly Geo, means the internet penetration that happened. It doesn't matter whether UPI was launched or not launched and how much it was launched, when it was launched, but the success was determined with the internet penetration. So what I'm trying to make everyone understand in this audience platform is that the success of telemedicine, e-pharmacy, everything now depends on implementation of ABHA and how the collaboration happens within the big startups, with the smaller startups, with the Indian government, with the state government. Because if that is unified, for example, the UPI has unified everything. It doesn't matter which bank you are from, what kind of, you have current bank account, saving bank account, what is, well, anything, but it doesn't matter. Similarly, if that level of collaboration happen, it will be a game changer. And believe me, Bill Gates today said, and I must say that 6 months, hardly it will take 6 months. By December 2023, the world will realize the power of UPI in terms of UHI. Okay, now UPI everybody has realized, UHI is going to be realized. So yeah, I think Uday has again a question from.
Sorry, because
Yeah, absolutely fine. Happy
this
to
is interesting. Basically, this is very interesting, and I'm also game in this. So, on the data perspective, if I understand with a very little limited knowledge of mine, when we talk about the data, so and on health perspective, and if I understand correctly, the ethnicity also matters for the data to process, right? And as we are getting digital, the data is getting available. However, if I go to US or something, the data is available in abundance where I can run my models. So a little bit curious on Indian model specifically. Where do we get the data? So we don't have enough digital data
agree.
to verify our knowledge, but to make our my AI algorithm train and deliver the way or the minimize the.
No, absolutely. So I will tell you a small thing. You will realize when I started in 2021 as a consultant, what was happening is that we had data, okay, but it was not structured. And it was not something which can be consumed by the model. There is a concept in data science I'm very fond of: garbage in, garbage out. If you put lot of data which is very much unstructured, then it is like a garbage. And if you put garbage, the model will also get you a garbage out. So what we did is that we collaborated with some of the hospitals, with few doctors, asking them कि आप अपना ICU data दे दो, because in hospital most of the, you can say, best place to get the data is ICU, because at least उधर monitor होता है, थोड़ा बहुत nurse monitor करते हैं, थोड़ा बहुत वही जगह था जहाँ पे possible था. We started from there. Then we scaled it up to startups. Now what is happening, for example, if you remember, I showed you that we have collaborated with My Healthcare. My Healthcare is a OPD based platform. they provide it to Paras Group, to Fortis, to Think. So we have taken anonymized data from them. Now we are running our models. We are building it up for chronic diseases. So data is there, but yeah, absolutely, you're absolutely correct कि वो data की quality as of now India में नहीं है. But I think जैसे मैंने बोला, आभा will be the game changer. जैसे ही वो आ जाता है, 1-2 महीने में इंडिया में इतना डेटा हो जाएगा कि we even will not know कि करना क्या है इसका. And believe me, I know of few companies which I'm in talks for a different topic. People are from Roche are there. They are now making a company that what they will do is that पेशेंट का डेटा के लिए पेशेंट को भी पैसा मिलेगा. अगर मैं आपका डेटा यूज कर रहा हूं, अभी तो कुछ पैसा नहीं मिलता, बट मिलना चाहिए ना. इट्स योर डेटा एक्चुअली. So that is also going to happen. So it's actually a very exciting times we are living in, and that's why I always mention in my presentation, it's a very super exciting space. Yeah.
So anyway, we have a long way to go and a long discussion. So maybe
Yeah.
I will connect personally. So that's
Yeah, sure. Yeah, happy to
to
connect.
get some little guidance. Okay. Give it up to
Thanks,
the ma'am.
Thanks everyone listening to this webinar today. We are already on time and we should be closing this. Thank you all.
Thank you so much.
Yeah, it was pleasure meeting you all.
Thank you,
And yeah.
thank you all participants for asking questions and clarifying all these things in this webinar. Thank you.